Greetings, this is a coronavirus COVID-19 update for 3/5/2020. And the first thing we look at every day is the Baidu numbers. Baidu is a Chinese search engine, and the link is below in the descriptions. We see that cumulative diagnosis in China today is 80,710, and the other interesting numbers on here, cumulative cure doesn't mean much, or it doesn't mean cure, it means recovered. And it's good to see that number going up. Existing severe cases is ICU cases. That's down from yesterday, 5,700. And deaths are up 30, which is pretty low for China, to 3,045 deaths. And if you scroll down further on the same page, right underneath that table, we see a map of China that doesn't change much every day. Then we see the first graph. There's two graphs, and this one plots new deaths, added cures or recoveries, new suspected cases, and new diagnosis. So there's only 145 new cases. You can see that red line is trending down. The gold line for suspected cases is trending down. Deaths is back and forth lately, but kind of trending down since mid-February. And new, let's see, recoveries is for some reason trending down in the last couple days, but it's generally an upward trend. And then the second graph, if you scroll down, it just compares non-Hubei province with Hubei province in the pink and the national numbers in red. And you can tell by looking at this, the Hubei graph pretty much follows the national graph because the Hubei province is the epicenter. That's where the city of Wuhan is, where all this stuff started. Scrolling down further, you'll see a list of provinces, and I have been leaving this Hubei province open lately to take a look at the cities, but these numbers are not updated yet. And then if you scroll down further, you get the Baidu stories of the day and the search terms. These search terms are kind of misleading sometimes, but these are the number one search terms to find new stories. So we'll take a look at some of these new stories that are interesting. I have 6 of them to take a look at here. The first news story is that a dog was infected, and this is pretty surprising and pretty alarming. Hopefully dogs won't be transmitting too much to other dogs. This is in Hong Kong where this happened. That would just leave the world in much worse shape. And upper right, the Ministry of Foreign Affairs China considers donating to the WHO after a plea from the WHO to for donations from countries. China is not exactly noted as a country that donates much money to anything. There's an organization and a index called the World Giving Index, and that was created by the British to try to encourage British people from donating. The U.S. is always at the top or near the top, and as far as money goes, that's always, the U.S. is the most giving country in the world. China is somewhere in, down below 100. So there's plenty of other countries that donate more than China. And then the third story is mask inventory meets only 1% of healthcare workers' needs in the United States. You might notice that if you have looked for a mask lately. I have. I'm not in need of any masks. I have a pretty good load of masks because I have a shop in my house. But Germany yesterday announced a ban on exporting all medical supplies, including masks. And the U.S. ought to consider doing that because we're still sending a lot of masks out of the country. Why? Because Chinese healthcare is ordering them, and we're shipping them to them. So we have to put a ban on the export of masks to get caught up in this country on our own medical supplies. The next story, this was an update from the Chinese Health Ministry. They listed a bunch of animals that are banned, that you are not allowed to eat, and a lot of animals that were kind of a surprise that they were left off the ban. So, can I eat it? That was the news today, is are all animals that are left off of this list, are you able to eat those? And what else do we have? Uh, the next story is 21 provinces and autonomous regions lower emergency response levels. That's because China pretty much has things under control, because they're taking measures to get things under control, basically turning all Chinese cities into ghost towns. People aren't allowed to go out. When they are allowed to go out every couple days to get food, they're tested, their temperatures are taken, and they make sure they have a mask on before they can enter any stores. And Beijing now, for the last story, they're worried about overseas threats, for the coronavirus. First, China spread this virus around to the rest of the world, and now China is concerned that, people from Korea could be coming to China and other highly infected areas. So they're starting to do something about looking at that. Then we take a look at the Johns Hopkins numbers. This is a center. This is a research center for systems and science and engineering. And they put together a global tracker that a lot of people have been using it. Just a couple days ago, I had news from Germany, where the German health administrators are sitting around a table, and there's a big screen of this Johns Hopkins thing in the background. So it's being used by people, and it's a really good tool. So the total number of confirmed cases for today, 97,886 right now, with 3,348 deaths. So one thing I do every day is take a look at the Johns Hopkins numbers compared with China. China has cumulative diagnosis today 80,710. As you can see, we show them 80,422, so down almost 300. So you would have to add 300 to that top number, and that would put the global number over 98,000. Then I take a look at the 3 hotspots. So these are areas of the world where the coronavirus is kind of getting out of hand. We have South Korea jumping from 5,600 cases to 6,000. Italy from 3,000 to 3,800. Really big jump there. And Iran from 2,900 to 3,500. So we'll take a look at these 3. And on the right, you can see the number of deaths. Italy, Iran, and South Korea. South Korea is kind of low, but it's still a bigger number of deaths than anywhere in China outside of Hubei province and outside of Wuhan, the city there. So these are big numbers. 35. You can see Henan province underneath at 22. And that is the second most populated province in China, behind Guangdong province down south. And that's 22 deaths. So there's 3 areas outside of China that have surpassed Henan in deaths. Okay, as far as these hotspots go, we'll start with South Korea. That's the biggest one. If you've been watching these videos, you know that this infection in South Korea started with a big church, a church that has 1,000 branches in Korea and 450,000 members. And that church people from that church were going to Wuhan as late as December to recruit people to join their church. And they brought back a super spreader, somehow got infected. A woman that was a 61-year-old woman that infected like 40 people on the first day by going to a big service at one of these churches. So that's how it all started. That area is, in the city Daegu, and the main news story coming out today was that a second red zone has been defined in Gyeongsang, and that is a community that's to the east of Daegu. So I have that circled on a map so you can see it's just their red zone now has been expanded a little bit to the east. And then on the lower left picture, a couple days ago, the South Korean president declared war on the virus and pledged a good sum of money to fight it, something the U.S. did today. And one of the results of this is these quarantine kits, food, water, and masks for, put together in a quarantine kit. If you're in a zone, they'll supply you with this stuff. That's part of, what they use the money for. So food, water, and masks, being sent out to everybody in quarantine. And on the lower right, there was a U.S. Air Force base that was close to this church, basically down the street, maybe 10 buildings is a U.S. Air Force base. And that's the headquarters of the U.S. Army in South Korea. So a soldier got infected because he visited Daegu, and he went back to the base, and then so far there's 6 cases there. Hopefully the Army's got this under control and it's not spreading anymore. And then we go to Italy. So what do we have going on in Italy? Death toll from coronavirus rises to 148. That's the highest number of deaths outside of China. Even though South Korea has a larger number of infected people, Italy has the most deaths. So they reported 41 new deaths from coronavirus on Thursday, bringing the total number to 148. 41 deaths in a day is almost as big as China has been in till mid-February. That's a pretty big number. Upper story on the upper right: Italy closes sporting events until April. So, all the sporting events will be held behind closed doors. The teams will participate. There won't be any fans there. So there was a baseball game like that in the United States a few years ago where the teams played to an empty stadium. I forget what the story was behind that. And on the lower left, just another picture out of the New York Post today showing an Italian restaurant where a server is waiting there for people, but there's no people there. So there's an area in Italy, mostly in Italy, and a couple of provinces up there that are red zones, and these red zones are being effectively isolated with roadblocks and stuff like that. So Italy's, you'd think they're getting things under control, but if you look at the number of new cases today, nothing's under control. Hopefully most of those cases are in the red zone and not getting out of the red zone, but we don't know that. Then Iran had this problem because they had a religious thing that was going on, and a pilgrimage to this religious site that was attended to by Iranian people and people in neighboring countries, and that meant that everybody was together in one confined space in this pilgrimage area, the city, and they were also sleeping in hostels and eating in confined restaurants and sharing the same bathrooms and stuff like that. So that's how the virus started spreading. So what do we have? Usually, like yesterday's news was that 23 Iranian political people were infected. So, and the health administration head is also infected. That was news a few days ago. So on the lower left, Iran halts all sporting events, and what do we have on the upper right? 15 new deaths. Then I take a look at some cities that aren't really hot zones. These are, under 500 infections. And first taking a look at Germany. So Germany, if you go up to the German, news sites like the one in the middle here, you don't read anything about Germany. It's all of the news stories are about areas outside of Germany. There's no explanation at all why Germany went from 262 to 482 today. That's the biggest, increase percentage that we have anywhere. But there's really no news. So upper left, National Public Radio, NPR, one of the German head of, or the German correspondent for NPR, has kids that were, in a closed German school today. An announcement came out that the school would close, so that leaves parents wondering what they're going to do, because kids are at home now, and kids naturally joyful kids, afraid parents. So the kids are all excited about it. They don't have to go to school, but the parents are wondering what to do with kids. And on the right, The Economist came out with an article today about COVID affecting the economy in Germany and Italy. And in the middle story out of Deutsche World, we have coronavirus. Italy and seeks EU permission for extra borrowing. And then there's a teacher teaching a class to an empty classroom. So, those are, remote classes now, learn from home type stuff. Then out of France today, France went from 285 to 377. The French president announced that France is expected to reach stage 3, which is the highest stage, which means an epidemic in France. That's what they expect. And on the right, new cases in Nord and Corsica. The person from Nord had just returned from Italy, and there's a couple people in Corsica, the island, who went to a big Lent event a couple days ago in France, and now they're infected. Okay, let's take a look at the U.S. now. The U.S. went from 153 cases yesterday to 221 today. That's almost up 70. That's almost 50% increase in the number of cases from yesterday to today. And hotspots in the United States, even though the numbers aren't anywhere near as bad as the rest of the world, we have hotspots in Seattle, King County, and San Francisco, Los Angeles, and New York. And if you take a look at the number, we have total number of deaths now at 12, and 10 in King County. So here's a story here out of Washington, mostly for King County. Washington State urges patience as COVID-19 test delays stoke anger. Well, yeah, why? Because there's not enough test cases, or there's not enough test kits. Washington state officials urged patience on Wednesday as medical staff reported fear and anger among people told they could not be tested for coronavirus due to limited capacity in a state facing the United States' deadliest outbreak. Limited capacity. Now, whose fault is this? This is back to the CDC again. The CDC, they're just a bunch of people sitting around a table smoking crack and not doing anything. Why don't they get off their butts and do something? This is crazy what their plan was. I don't know. They wait for people to die before they get off their butts to do something. It's really frustrating. I spent decades working as a federal government consultant, and some of the dumbest people on the planet work for the federal government in the United States. So here, what do we have? We had a policy, this started out a couple days ago when we had our second death in the United States. And there was a woman in King County. Her doctor, was going crazy because he wanted a test done. And the CDC came back and said she doesn't meet the criteria for a test. Okay, and because their policy before a few days ago, they changed this a couple days ago, their policy was, hey, you have to meet some really stringent criteria, and then you have to send your sample from Washington to Washington, D.C., where the CDC is. Why? Because these people smoke crack all day. They're insane. Why would you, this is supposed to be an advanced society, as far as, and really good medical facilities in the United States. But this is just totally stupid. They wait till, a bunch of people die, and then they finally say, oh, all right, we'll set up some other test centers across the United States, and we'll start making some test kits, because the United States had only done 1,000 tests altogether as of a few days ago, where China is doing 1 million a day and South Korea is doing 100,000 a day. We're doing 1,000 altogether because we have these stringent policies that say, no, you have to be almost dead to get a test done, and then you have to send your sample from Washington State to Washington, D.C. Who would think of something like that? A 12-year-old would have more sense than to do something like this. The CDC is really good at self-promotion, saying, oh, CDC, we're going to China today because we're going to help out people. Everything that they can do to self-promote themselves, they do. And in the United States, they kill people because of their policies, because nobody has a brain in the entire outfit. So what do we have going on here other than the CDC being insane? Another cruise ship. This is kind of crazy too. There's 3,500 people now on another cruise ship. The first one was the Diamond Princess in Tokyo. Now this one's the Diamond something else, or the Princess something else. What is it? I forget the name of the ship. Anyways, there's another Princess ship, and it's docked off of California now. And the reason it was ordered back to port and people confined to their cabins was because somebody who had been on that ship a month ago when it was out died, because there were some people that tested positive on this cruise ship. So, a cruise ship, okay, you're a cruise line, and some people got their cruise cut short, so you give them free cruises. That's nice. But 62 people went out again the next time the ship went out. And of those 62 people, some of them are, now we have 220 people on this ship who are infected. Now, how did they get infected? I don't know. The crew or other passengers that were on, that were infected the last time the ship was out. So we have another dilemma here with the cruise ship. Somebody ought to, get it together and say, cruise ships, you're a public gathering, public gathering, and you're docking in San Francisco, which is an American hotspot. Stop cruise ships from operating out of San Francisco. Then what else? We actually, are the most dysfunctional government in the world, who they don't know how to do anything but fight each other. It's not a government, it's a war between Democrats and Republicans, and they don't do anything but make total assholes out of themselves. So the Senate and Congress, the Senate and the House finally got together and passed this bill, $8.3 billion. And, you kind of wonder how they even did that, because, all they do is fight each other. It's basically the House versus the Senate, the Democrat-controlled House versus the Republican-controlled Senate. All they do is fight. But they did manage to get a bill passed, $8.3 billion emergency bill. And that's good news. And what else do we have coming out of the U.S. today? There aren't too many specific stories. USA Today, they dispelled a rumor that people were looking at a $3,000 charge for a test kit. They said that's false. So let's take a look at some of the actions by other countries, namely China. So China made a lot of mistakes, and we can learn by their mistakes if we are capable of learning. So the first one, make medical supplies and resources and test kits a priority. Get them distributed to the hot zone where they ran out, and they did that eventually. Define red zones and hotspot areas. Well, they did that eventually too. They were, the first thing China did was they canceled all flights in and out of Wuhan, which was, the epicenter in the early days. They canceled Chinese New Year's all across the country, and said no big public gatherings, no New Year's celebrations. So then they locked down Wuhan by canceling flights, but 500,000 people still got out of the city and infected the rest of the world, and that's why we're in this kind of shape right now. But once they did lock down Wuhan, they started locking down all major cities. So all major cities in China, you've seen pictures of Beijing and Shanghai, and everything's a ghost town now. Nobody's out on the streets. Everybody's confined to their own homes. So, and then bring in the Army or National Guard for roadblocks and checkpoints. Well, they finally did that around Wuhan. So there's really, in Wuhan, there's not many people going back and forth, except for food trucks coming in from the country. Encourage work from home. They did that, or they said don't work. If you work in a factory, you're just not going to work for a while. So basically, China shut down everything. Restrict large public gatherings. That was done in Wuhan right away, and elsewhere in the country, maybe a little bit too late, but at least it's enforced. Restrictions for people to leave homes and screening at grocery stores and other public places. For example, I know people in Beijing, they can go out every 3 days now. One person from the family can go out every 3 days to go grocery shopping, which is adequate, but, and in some places like in Wuhan, you just can't go out. I covered this a couple days ago in a video where, a lot of high-rise complexes, are making deals with grocery stores, and the grocery store says, I'm not going to take 1,000 orders and deliver everybody something different. You guys all get this for dinner tonight, and they are, for the next 2 days or 3 days, and they'll deliver to one specific building or 2 buildings in a big complex of a zillion buildings, residential high-rise towers, and they'll, make individual arrangements with grocery stores. So that's total lockdown in Wuhan and restricted lockdowns everywhere else. Bring in the Army or National Guard medics from the outside. Well, China made a mistake here too, because they sent in the Army medics right away. But then, a few days later, they, made the news because 1,700 medical people, frontline medical people, got infected with coronavirus. So they sent them in without the right protection, without Tyvek suits and goggles and masks. And the last thing, spraying down large areas of cities. If you've seen pictures of Wuhan lately, it's like a chemical wasteland. It's all sprayed down with alcohol. Big, huge trucks driving by and spraying down the whole city. And in other cities, it's hot areas that get sprayed down. So we'll take a look at some of these. So these are some pictures that made the news that are in older videos that I have. One, this is a, Tyvek. This is a DuPont factory in Shanghai. And, they're shipping out truckloads and truckloads of these Tyvek suits and masks and goggles, to the epicenter. And that's something in the United States. What are we doing? We're still sending our materials and supplies to China. Germany a couple days ago announced that, they're going to outlaw the export of all medical supplies. We need to do that. Because why? Because in the United States, you can't buy a mask. And the CDC actually came out, and, I think the White House also came out and said, people need to stop buying masks because, most people don't need them. And we don't have enough for our medical people. But, the reason we don't have enough is because China is ordering these things from the United States. We got to stop the export of masks and use them for our own people, our own health people, and then, the public in hotspot areas like, Seattle and San Francisco, LA, New York, let them buy masks. Okay, and then the second thing China did, they built 2 new 1,000-seat hospitals in a week. They announced they were going to do that. They did it. They built hospitals. And the result, on the bottom here, you have one of these new hospitals, people outfitted with protective gear, and they stopped killing medical people. Then what do we have? China locks down second city. These are, if you look at the upper left picture and the lower right, these are videos where you can use infrared to check a large number of people at the same time for fevers. And the upper left is China, the lower right, I think that was Sri Lanka. It was either Sri Lanka or India. And on the middle picture here, the way they do for every grocery store in China, you have to have a mask on, they have to take your temperature, and you have to not have a temperature. Then, the lockdowns. This is Wuhan. Wuhan's a ghost town. All cities are ghost towns. You've seen pictures in the news or in previous videos where Shanghai is a ghost town, Beijing's a ghost town, all the big cities in China are a ghost town. Guangzhou, they all look like this. Nobody's out on the street. And then spraying down things. Here's the top 3 photos here are in Wuhan. So that you have something that looks like a big truck, going by and spraying disinfectant everywhere in a big highway-looking area. And in the middle, going down a residential area, spraying, among the residential towers, spraying them. And a guy on the right in some kind of a commercial, street with a bunch of shops. He's going down with a handheld sprayer, spraying everything. So the top 3 are China. The bottom 3 are South Korea. Here's 3 South Korean trucks, and if you look behind them, it looks like it rained. They're spraying down the whole city with disinfectant. In the middle picture too, this is South Korean army people, spraying, walking down the street and spraying. And on the lower right, other people spraying in specific areas. So, people are actually doing something to spray down these areas that are hot spots. We're not doing anything for, our hot spots. We haven't started doing this stuff yet, even though, it looks like in a couple of areas we should be doing this. And then, this is a graph that I used to take a look at every day, but now it's worthless because these people, Center for System Science and Engineering, you'd think they could make a graph. And it was okay up until like a week ago, where the scale on the right is at 90K now. We're at 98 people, and the line should be touching the top at 98. If you have the scale on the left is at 100, it should almost be touching the top. So I can't tell, by this graph what the trend is. I've been mapping trends for, over a month now, and the cases are going up, but we can't graphically see how bad they're going up every day globally because we don't have a graph that'll show us that. Okay, that's all the news we had for today. Appreciate your time.